specific and culture universal nursing care, because there are some things that are just universal for everybody. I love this. This was the definition of a culturally competent nurse. Now, if anybody in this room thinks that they're 100%, let me just bow down to you right now, because I think this is such a difficult standard to meet. You're consciously addressing the fact that there are differences and they affect your interactions. With compassion and clarity, you ask each client about their cultural practices. Well, I know for sure I don't do that. Not every single person. Then you take that knowledge and you incorporate it into their plan of care. The true meaning of individualized care plan. And you respect their different culture. You're always trying to learn more about other cultures. So then I sort of was led into, without even realizing it was going to happen, Josefina Campina Bacote. Her model talks about kind of the same things, but the thing that struck me right away is that she says it's an ongoing process. It's not a state of being. It's an ongoing process. Okay? And that's just sort of, don't you love Venn diagrams? That's a Venn diagram. If you get all of those things right, then you have the process of cultural competence. So when you're talking about application to practice, the standards are out there. They're being talked about. What we should be doing, we should be looking at human dignity and social justice when we're teaching students at whatever level. The National Student Nurses Association, they're right in there too. They're right on top of things. The National League for Nursing doesn't do as well. They don't address the issue directly. They're sort of around the fringes. There's not a lot out there about curriculum. So this is a big area that everybody who's an educator has to really start thinking about. Educators at all levels have to work to develop. So the ways that you do it, you figure out your own beliefs, understand your own thought process, and then you share that with your students. And you help them to look in the mirror at their own beliefs and progress beyond whatever narrow vision they started out with. Incorporate it into all of the settings. I loved what you were talking about, Laura. I was identifying with so much of what you were saying because it plays into this. There's a lot of movies. In our graduate classes, we've looked at movies progressively through a class to see what was happening. There's a lot of movies out there that can illustrate these points. And then there's other resources out there. There's a lot of resources out there if you search, but you have to search actively. This movie, if we had more time, I'd play you the clip, and maybe if there's not questions, maybe I'll play it. But this is a movie that's focused on the aging LGBT population. And there are actual couples in there that talk about their struggles. It's a really, really great film. I didn't put all my references in because I have like 50, so you didn't want to see that. So questions? Yes?
How would a healthcare professional ascertain the difference between a person who would come in that would be an LGBT or a heterosexual?
You ask the question.
Oh, you can.
You ask the question.
Okay.
Most healthcare providers aren't very comfortable asking about sexuality at all.
Right.
And so that's something that we have to get over as providers. We have to be able to ask the question. Yes?
What situation, I've never asked that question. I'm just asking, what situation are you talking about that me as a healthcare provider would be asking that question?
When you admit somebody?
No, I'm saying, on my admission form, I do not ask that question.
But
That's
we
what I'm
should.
asking. I'm like, why would it matter? Why should we ask that question? Why does it matter? I don't care if that person is
No.
it's not gonna affect my care.
No, it may not, but it may affect your ability to provide the care that's best for them. It's like not asking somebody what part of Asia they come from. They have sort of slanted eyes, so we know they're from Asia, and we don't really care where they came from. But the fact is that there are a lot different health practices in China than there are in Japan, and it's an important question to ask. Same thing applies for sexuality.
How would,
We're not culturally competent.
how would you recommend then to teach nurses how to handle, say, a family member that doesn't agree with the person's choices?
Well, some of that comes down to advance directives. There should always be an advance directive, and that person that's named in the advance directive needs to be the one that you talk to. Just like you're gonna be the person that anybody talks to for me, because you're my spouse.
Well, I'm gonna also, can I just chime in on your question? Is just at my hospital that I work at, your family is who you say your family is. It doesn't matter who the family, if it's actually not a family member. So if that person doesn't agree with that family member, maybe that family member hasn't talked to that family member in 20 years.
Exactly.
But just because that's the next kin, doesn't mean we're gonna direct everything towards them. So the patient tells us who their family is. And it doesn't matter if they're actually related or not.
There were a couple of cases that I read about where somebody had an advance directive, a couple had put an advance directive in place, but it was being kept at a sister's house because she had a safe place to keep it. And then one person in the couple went into a nursing home and she wouldn't release it. And she ended up making it so that that person's partner could never come and visit at all. It was sad, and it was recent. Yes?
I'm thinking that in most healthcare settings, in the nursing assessment tools that exist right now, that question doesn't exist. Did they give you ideas on how to ask that question? I mean, is it just a direct question, what is your sexuality? What,
Yeah, that's the easiest.
yeah.
That's the easiest way, is to just ask, or who's your partner? Not just say, you've got a wife now, or what's your husband's name if you're a woman. Yeah.
Laura, I was just a personal experience this week. I had an internist checkup appointment, and the annual history form, this was the first time I noticed that, changed what marking I could make, and it gave me a lot of choices. And so that was in an internist's office.
So there's
They're
progress being
starting some
made.
progress.
Yeah, there's progress being made, but that goes back to that whole institutional bias. You know, the US Census just arbitrarily made the decision in 2000 to classify all same-sex couples as unmarried, no matter what their legal status actually was.
Laura, you were talking about all the VAs that have taken those courses, and our documentation, when we're actually admitting a new person, they're on the first initial assessment, it's actually asked, what is your preference of your sexuality?
Good.
That's great.
Just one other question.
Yeah.
What is an omnisexual? I'm trying to
It
think
means
what
you're
om-
open to lots of different things.
Oh. Okay.
I was just going to speak from experience what maybe where you were going with that. And this just had to do with a privacy issue, somebody that came in for surgery. For the privacy reasons, we changed their name, but somebody who was admitting them decided to change their gender as well. So then, of course, lab was calling us up and said, what's going on here? Because these labs are all out of whack. And so I know that also comes up if someone is transgender, has undergone a gender change. So that's kind of the time that it does help. But most people are pretty upfront about it when they're giving it their admission history. But I guess it is a good question to ask if somebody hasn't told, like, good to get the advice from you on how do you ask that question if it's not been.
What's your sexual preference?
Well, sexual preference, but then also
What's your
biologically,
gender?
how were you born, so that you know when those kind of situations come up.
What did your research show? as far as the response from the client as to the authenticity of what it was that they were declaring. In other words, they may feel uncomfortable and they may say that they're something that they're not. So how accurate, what did your research show as far as in applying?
That specific question was never addressed, and it's a really good question. If you have somebody that's historically been treated badly by medical care providers, then they might not want to admit. So that's a really good, and probably a point for further research.
Well, I'm trying to apply in practice what it is that you're saying, which is a great topic, and I think you're cutting edge, but without having the research as to the response on a direct question, if you're getting the right answer or not, really distorts the whole thing.
Yeah. Yeah, it takes a level of trust. And it may be that you're gonna ask the question more than once, you know? You may see all of the family members of this person are all members of the same sex that aren't actually blood relations. That may be a reason for you to ask the question again, after that person has developed a little bit of trust with you because you're taking care of them.
Well, and then if you get two different answers, how does that play into your statistics?
Well, if you're doing a study, it's gonna be a problem.
Thank you, Chairman.
Look at that